Hi, how are you?
Good. How you doing?
Good, good. It's a beautiful day. It's really nice out here.
Savannah, I'm really excited that you agreed to join us. You have some conditions that I think that um, having you share your story will help a lot of people. And
Yeah, absolutely. So with like endometriosis, all my pelvic stuff kind of started when I was quite young. I was 15 or so. Um, so I had begun having very, very painful menstrual cycles, just unbelievable, can't get out of bed pain. Um, but of course, this was more than 20 years ago. Um, Endometriosis wasn't a term that everyone knew. And so it wasn't anything that I was like, oh, I think something's wrong. It was always just like, oh, you're just a baby, you have cramps, you go to school. It was just
yeah, like nothing out of the ordinary, but you're just complaining about it, right?
exactly. And so it that poor mentality of like women are just designed to suffer alone and quiet. Like it's just like, and so I said something once to my mom, and she was kind of brushed it off as the whole, oh, it's just cramps, go to school.
Yeah.
Um, but I did sports and I did theater, and it was so bad. I mean, I couldn't participate at time, like whenever I did have like a menstrual cycle. Um, and it just progressively got worse. I'm an open book about this. I know that some people, when it comes to pelvic disorders, they can kind of shy away. They kind of get embarrassed. But to me, it's something that at some point I was like, you know what? There's no point in being embarrassed or shy about this because this is me. This is something I'm going through. This is my truth. And I know there's other people out there that know this exact same feeling.
Mhm.
Um, it's lonely, and when you suffer in silence. So when I was 18, I was in college. I finally went to like a GYN myself, and they did an ultrasound and they found huge grapefruit sized cysts. He wanted to just kind of monitor them and see, because sometimes cysts will kind of shrink and grow throughout cycles, throughout the month. And sometimes they can go away. Unfortunately, with mine, they didn't. And so we did have to move forward with surgery. And so my first surgery was very uneventful, just remove cysts. At some point, I was like, you know what? There's no point in being embarrassed or shy about this because this is me. This is something I'm going through. This is my truth. And I know there's other people out there that know this exact same feeling. That surgery itself was rough. So we got home from the surgery center. It was an outpatient surgery center. Um, and I had told them before I left that I was in a lot of pain. I was feeling a lot of pressure. And they were like, oh, it's just normal. It's inflammation. So I get home, and it was almost 24 hours that I couldn't urinate because there was so much pressure. It was so painful. So we finally like called the doctor, and they were like, oh, it's probably an infection. Here's some antibiotics. The doctor left for China. And it was like, oh, well, okay. Um, thanks for
Yeah.
coming
Thank you.
letting me come in and see someone. But
Yeah.
so my partner finally took me to the ER, and they found that my bladder had been punctured during the surgery. And it had like bled and caused a hematoma. He said, I'll never forget it, the way he said it. He said it was a hematoma the size of a small pillow. Endometriosis can spread anywhere in your body. They
Oh my
found it
God.
in the lungs. They've even found it in brain tissue. Like it's just wild how,
Really?
and they don't even know what causes it. And eventually he suggested that a hysterectomy would have been a full cure. And so um, we kind of wavered back and forth. We did a couple more laparoscopies, and it was just getting worse and worse. Every time you went back in to clear it out. And so finally, when I was 24, I did agree to the hysterectomy. And that was tough because I'm thinking, okay, now my whole like life trajectory has changed.
Yeah.
Like it's altered now permanently.
Yeah.
And we were excited. We were like, okay, cool. We can put this chapter behind us.
Yeah.
And we'll start living, because I mean, at 24, I never got to be a kid. Like it was just like suffering. That was all I knew. The fact is with endometriosis is that the implants start so tiny, they're microscopic, you can't see them. And so doctors, they can go in and try to remove everything they can, but those microscopic ones, they're not going to find. A condition where the tissue of the uterine lining is implanted outside the uterus within the pelvic cavity, the abdominal cavity. And the problem is that when it grows, it kind of grows like really sticky spider webs. And so it just kind of sticks to things and attaches things. So like I had an ovary attached to like my pelvic wall, and my uterus was attached to my bladder. Like it just, and so with those implants, they'll grow endometriomas, which are kind of like the growth, the masses of it. And that tissue will bleed like a uterine lining would. It's like when you have your menstrual cycle. So not only are you having a menstrual cycle, but you're also, those implants within your pelvic cavity are bleeding and causing inflammation. And so the pain is so bad. And I know it's really unique to everyone else, kind of how they feel it. It's a lot of pressure, because when that inflammation,
it's bound up.
Exactly.
It's like a binding tissue, and it's binding things in wrong ways. And
and so it's like even like movements, like twisting movements could cause like some of that tissue to tear, and it's just the sharpest pain. It causes very similar things where it can attach things to things. She had to peel a layer, like it had just kind of like formed the shell around my bladder. Wow. And so like that scar tissue and the endometriosis, like it was just all causing my bladder just to be absolutely awful. I mean, it hurt so bad to pee. I still, to this day, it's very painful. So the hysterectomy was actually prior to this. So the hysterectomy was in 2010. And so by 2017, like the endometriosis was rampant. Like, I mean, that mutual support is so important. And of course it was hard to hear at first that, that, I mean, I remember the first time he was just like, I'm not happy. And I was so hurt, and I was so just taken aback. And I thought I was finally like alone, and I was just thinking about our conversation. And I thought, I'm not happy either. This isn't where I wanted my life to be either. And so it's okay if he's not happy with where we're at. Like, he wasn't not like happy with me, but just not happy with this isn't where we thought we would be. I don't know why, but we've never really been a couple that argues. We've always been the type of people that kind of say how we feel, separate, each of us process, come back. And that comeback conversation is always the best. Like, it's so cathartic. And because we can both kind of try to interpret what we heard, think about, how does that make me feel? Do I resonate with how they're feeling? Yeah, I do. And so it's easy to kind of get your feelings hurt, but it's important to remember that everything is different than the plan.
It's just part of maturing.
It's a process. It's definitely a process. As much as I would love to go through life just kicking and screaming, especially when you don't feel good and you're tired and you're exhausted. And I mean, gosh, I mean, it's your whole body chemistry changes when you go through things like this, especially with like the potent medications they give you. There's lasting side effects. And so, I mean, it changes you, and so you're not sleeping, you're taking medications, you're probably not eating properly. And so you just, it builds. It's very easy to take something said so wrong. I remember I felt really bad afterwards, because I was like, you know what? He doesn't share his feelings a whole lot. And you kind of bulldozed over him after he said that.
Kind of a reaction.
And that's not a way, to get him to keep opening up to you. So this is really counterproductive, Savannah. Like, come on. So that, I mean, it's a learning process, and of course, I mean, I've had years of therapy because of all of this. I'm always trying to, encourage folks, this is really important. Mental health is just as important as heart health or cardiovascular is heart health, but it needs to be cared for, like just like anything. And it is common, that feeling of just wanting to give up. I mean, I don't know. I have done 3 intensive outpatient programs for mental health, just because I was just on the precipice of not being able to take it anymore. It's easy to lose sight of what you have and the people who do support you in those moments. You feel unsupported, you feel completely alone, you feel like there's no future, but there are people. You have people that would be heartbroken, even though you're telling yourself in that moment, this is going to be so good for everybody. I'm going to take away their burden.
Yeah.
But you know what burden they would have to carry after that is the thought, the fact that you ended your life. Pain management has saved my life. Talking to your doctor, this is what we do, figuring out medications, physical therapy, all kinds of things. And then spinal nerve blocks is where we started. So it's just where they inject a steroid and an anesthetic into the nerve that could, is affecting wherever you're having pain. It doesn't take away the pain completely. Nothing is going to take away the pain completely. But it helps the sharpness. It helps just the bigness of it. Just like it tones it down. A lot of the pain I was having changed or as time went on. So I do still have that widespread kind of pelvic pain. It's always been more on the right. But that groin pain was just getting worse, and it then kind of went into like the perineum, and then having these vaginal and rectal spasms that were so sharp, it makes me like jump out of my seat. Continue with the nerve blocks every few months. The one they did was down, like in my hip. They kind of go through. So it's not right on the spine, it's like low and then just slightly to the right. And they have to guide the needle through this like little tiny hole, the foramen where the nerves, pass through. And it's so fascinating because you're awake and you're talking to them the whole time. You have to do a trial implant first before they would ever do an internal one. So the neurostimulator, it's a battery, it's a little battery. They implant it kind of in your buttock, like right below your belt line. So kind of like your hip, your high buttock, like, and then the wires for the neurostimulator, it depends on where they're going and how many nerves they want to hit. They'll kind of snake it up under your skin. It's really like, just thinking that kind of gives you the heebie-jeebies, but they, move it up your skin and then they guide it through the foramen in your spine, like in your different vertebrae. So for mine, we did L1 and S2 bilaterally. So we did 4 during the trial. All the wires and everything's outside your body. So they stick all these 4 wires like through your back and your spine, and they just like tape it all up to your back, and you have to just be still for a week. Like you can't shower with it on. Like you have to just do sponge baths, and it's like you're so worried about movement because you don't want to pull these wires out. Like, because we're trying to, test out this and see if it's going to work. And it was really beneficial. It was one of those things that I didn't realize how beneficial it was until the trial was over. So they took it out, and then like the pain like got worse, and it was like, oh, that really was helpful. This is great.
Electrical shock, like how does it function and what is it doing?
Yeah, so you have a device. So like I have it's a little iPod, and and it shows you all 4 leads and where they're implanted at, and you can adjust the strength of the signal from the battery. The goal is to not feel. You don't want to feel the shocks or the vibrations. It kind of feels like little like vibrations. sometimes your muscles will kind of do like, it's kind of so like, have you ever used a TENS unit, like where your muscles like,
Yeah. Well, I've
yeah,
seen. Yeah. Nell did a little bit of that. I think she's got one, right? Yeah, and it kind of contracts and kind of yeah.
yeah. So it's kind of similar, but that's right on your nerve. And so I would feel it like all the way down my right leg, like to my toe. I was like, it was so strong. And so we had to really dial the L1 back. And so you kind of just go through one by one and adjust the strengths. And the strength, varies sometimes. Like if it's not placed directly on the nerve, you might not feel it as strong, but you still are going to get some benefit to it. So we finally decided to go through with it. And so I got in to see a surgeon at OHSU, which is our like the best hospital in Oregon. Level 1 trauma center, has all like the specialists that are known. And Omicron happened, and then it just like stopped everything. Like the hospital was canceling everything, canceling all our surgeries. So I didn't get in until January. We did do the implant. I was finally able to get it done, and it was so exciting. It was like, this is my last surgery. This is gonna be great. Um, but unfortunately, I feel like it's just like the string of luck. Like, the pain was so severe from that procedure, way worse than I thought it would be. It's 5 incisions in your back. So you have the one big one where they kind of stuff the battery in, but you
Yeah.
have 4 where they have to like guide the lead through your vertebrae. And trying to lay down or trying to transfer, trying to get up, like everything was so painful that I was gritting my teeth so hard that I broke a tooth and it got infected. And so it's after the surgery, it's like 6 weeks of strict bed rest because you want these wires to get scar tissue around them so that they
Hold
stay
them
in
in. Yeah.
place.
Yeah.
Yeah, so you have to be still. But unfortunately, I had to go to the dentist. I mean, it felt like my jaw was broken. It hurt so bad. So we went to I called them first, my surgeon, and I said, is there any way that my jaw was injured when you were intubating me? And they were like, no, call your dentist. And I was like, okay, cool. So I went and they were like, yeah, you have to have a root canal. And I was like, okay, can we do this here? And they were like, no, you have to see a different dentist, type of dentist. And so
Yeah.
a week later,
Surgical.
I had to go and get a root canal. So I was doing so much movement, that everything came out of place. All the leads, all 4 of them. So I was starting to feel pain again, like a stronger pain. Like I wasn't getting the benefit of the leads. And so what those leads were doing is it's similar to the nerve blocks. It's they kind of just lessen the sharpness of everything. And for me, for my bladder pain, it was an instant, like pain to no pain with my bladder. I mean, I could have cried when I sat down to pee. And so like slowly it was starting to hurt more and more. And I'm like,
You
what the
mean
heck?
relief?
So
You mean that's the degree of relief you were getting from
yeah,
really?
it was amazing. And the vaginal and rectal spasms were definitely lessened. The pain from the nerve, it kind of runs under your buttocks. And so it's just my butt hurts constantly. My right butt cheek is just, so I'm always like, my butt. My partner's like,
Yeah.
stop saying that. It hurts. We have code for when I'm having vaginal and rectal spasms. It's my donut and my biscuit are hurting, like like our code instead of like.
Yeah, well, you gotta, because exactly. I mean, they're there to support you, and you don't.
Yeah.
And what can you do to help? Yeah, you want to get relief. That's really what it comes down to. And you get into those routines. Like like Nell, it will help her for me to put massager on her foot and stuff like that.
Yeah.
So yeah, I can very much relate to that, and that you get into that habit and that routine of what can we do to help, because I'm kind of getting desperate.
Right, exactly. Yeah. I mean, we've been able to find humor in a lot of this. I think that's just kind of, we both had kind of traumatic childhoods. So I think that's just how a lot of people that have traumatic childhood, how they cope. And so it's just we're goofballs. And since we don't have kids, we're just big kids. Like that's kind of what we decided. We're just going to be big kids and do whatever we want. And so, so I called the doctor. I was like, you know what? I am not feeling the relief that I felt initially. And so I went in and they took x-rays, and sure enough, it shows all the leads are out of place. Mm-hmm. And so that was really upsetting to hear, but wasn't unsurprising just because of how much movement I did. And so next Friday, 6 days from now, we are redoing the whole thing. And I am nervous and I don't want to do it again because of how bad that pain was.
You're talking about how you're still needing to go back and get redone. Oh, that's right. So you mentioned that. You mentioned that you're going to be.
That's why I spaced this, because I've just been in my own head trying to get ready for the next surgery, because there's a lot of prep you have to do when you're going
to have them redo it, right? And then you're going to have to stay put for like 6 weeks. Oh, you're going to have to keep me updated with what's going on. It's just an example where, it's not like you interview when you've arrived with this story to tell.
Right. It continues.
You survived it, and it's now time to peacefully pass on.
Right.
It's just pause. We're sharing story up to this point, but then
right. Like right now I'm sitting here, I'm absolutely miserable. But it's just, you have to put on a smile. Like, you don't have to. Of course, do whatever you want. If you want to sit in your bed and cry, do it. But you can't stay there. You have to get up. You have to talk to people. And it is that 6 weeks, so I learned some things, definitely. Before they do this surgery, you actually have to meet with you have to have a psychiatric evaluation, like a intense one, just to make sure that you can do this. Like, they tell you it's going to be hard. And I was like, you know what? I was thinking the whole time, I was really taking advantage of that appointment with the psychiatrist. I was kind of like smug. I wasn't rude to her or anything. I didn't say anything. I just answered all the questions. And, it was just like 100 questions. Like, I don't know. But I was thinking, I got this. This is nothing. I've been through so many surgeries. This is going to be a cakewalk. It was not a cakewalk at all. It was so hard. And it was very isolating because, you have to be in bed for 6 weeks. Wow. And we have 4 cats. So those are our children. And I'm kind of their primary person. And so Robert had to take over all those duties. And he's the only one that works. I haven't worked in, 3.5 years now. Time flies by. And that was a hard decision, but it was the best, because it was my mental health or my physical. Like, it was working while trying to manage pain and, keep a happy face for 8 hours a day while you're facing customers or whatever. Like, and then you just come home and you're wiped. And so it's work, sleep. That's all you do. And it was just like, it was affecting my mental health so much. And it was like, you know what? It's not worth it. It's not worth your life, because ultimately, if this is the road we're going to keep going down, I don't want to lose you. So I will work, and we're going to take care of you. And when you're ready, you'll go back to work. So I've been very fortunate. It's a lot of work, the 4 cats and trying to work. And so it was basically, I would see Robert every 6 hours, because he would come in with like a pain pill or remind me to take a pain pill. And then it was back to work. And it was like, okay, now I'm just in here alone. Like, and I did have a couple meltdowns because it's so painful and you're alone, and it's just like, I can't do this. But you can do it. You give yourself kind of that grace that, and then just fill it with things that you love and enjoy. I paint a lot. That's kind of like my little personal therapy. It's important to give yourself rest. If you push yourself beyond your limit, you are going to wreck yourself. It's not a weakness to say, you know what, I've hit my limit right now. That's fine. There's so many people that really push themselves, and it's like, it's not healthy, especially if you have a condition and you're stubborn and you want to prove to everyone that you're still capable,
Yeah,
like, it's
yeah,
not worth it. It's not worth it. Take care of yourself. It's easy to define yourself based on what you do or what you can't do, or
yeah.
the work you used to do versus the work now. Like before all this started, I was an EMT at a fire station, and then
Oh,
I slowly just couldn't do it. It was so I went into diagnostic imaging for 8 years, and then I went to IT for our like a major health system here.
yeah,
But that was the last job I had. It was just like, I can't do this. And it's easy to say this is how far I've fallen. Like, I was the EMT at fire station. I was strong. I was capable of doing anything, like anything. I could handle anything. I'm still really calm under crisis. Like, I'm just, I don't know, not like fortitude. I don't know who I got it from. Probably both my parents. But it's just, you can't see it that way. You can't say it that way. The more you say something to yourself, the more you're going to believe it. So it's really important when you catch yourself in that pattern of, if someone has a similar situation to me where they've kind of, it feels like this downgrade, this fall, but it's not at all. It's part of your path. This is a linear path. And as you go, I know that my sense of humor has definitely improved over the years. My mental health has improved just because of how much help I've gotten, and my capability to handle all these different speed bumps. That's what we call them, just speed bumps. And we always say, our saying here is upward trajectory. Our life is an upward trajectory because it's improving. Our relationship improves.
yeah.
Like, yeah. And so, like, no matter what, something is improving. It's important to focus on those things rather than something that you might say is like, a fall from grace. It's just different. And yeah, life's good. Life is good. It's hard. It is absolutely hard. It's a kick in the pants every now and then, but life's good. Life is good.
Spoonful of sugar. Yeah. So that's what this is all about.
Right.
And
Right. And TikTok is
also,
such an amazing platform, like,
yeah.
to share stories, and that was my original goal, was to make videos all the time. I don't know if you've looked at my page. I haven't really talked about pain, gosh, since like December or November. We had a family trauma in November, and I felt like my life imploded. But I'm still here. I'm still going, but that's why I haven't posted anything. But I'm gonna try to post some videos before the next surgery. And then
Yeah.
I want to, document the road after that, because it's gonna be, it's gonna be different but new, and we're gonna try, a different way to anchor the device, and then I'm excited to see what I'm gonna be capable of, you know,
Yeah, with that,
months from now.
it already gave you a lot of relief.
Exactly.
So there's a
So
lot to look forward to.
yeah, yeah. Yeah, last summer when we were deciding this, I was so excited. I was like buying like summer clothes and like talking to my sister about like paddleboarding, like I'm gonna do all this stuff. And
Yeah.
I'm still, I got really a little depressed when everything kept getting pushed out and pushed out. And then of course when this failed, and it's just you just gotta keep pushing forward. Upward trajectory. There's always an upward
Yeah.
trajectory somehow. I
So
know my story is like very unique, but it's also not.
yeah,
I
yeah,
have different pieces that make me unique, of
yeah,
course. And of course, someone might connect with this and someone might connect with that, but I'm hoping that it'll be
yeah,
beneficial. Yeah.
it will. So thank you so much for joining us, and
Yeah. Thank you so much for having me. I really appreciate it. This is great.
that. And Nell gives her love as well.
Absolutely. Yeah. Send her my love. Yeah.
So,
I totally get it. There was a moment this morning where I was like, I really am in a lot of pain. Do I cancel this? Like, no, let's do it. This is important to
you're gonna
get.
go get
Yeah.
some rest. Yeah, go
Yeah.
get.
I am going to. I want to crawl back in bed.
Well, thank you for
Cool.
spending your morning with us,
No,
and
thank you.
the rest, and we'll be in touch. Okay.
Cool. Thanks. Take care.
Okay, we'll see ya.